Good afternoon, everybody, and welcome to the latest in our Methods seminar series organised by City, University of London, European Social Survey and the National Centre for Social Research. I'm Eric Harrison. I'm Deputy Director at ESS headquarters in London. So before I hand over to today's speakers, just to say that the talk will last about 40 to 45 minutes, and then there'll be an opportunity to ask questions. If you'd like to leave a question for our speakers, you can do so at any time during the presentation by using the Q&A function at the bottom of your Zoom screen, not the chat, please. So I'll be monitoring these, and then I will take a selection of as many of these as I can fit in at the end of the talk. So thanks very much in advance. So now I'm going to introduce our speakers, who are from the European Foundation for Living and Working Conditions. And this is a presentation really about the unintended consequences of COVID. So immediately hand over to Daphne to give us our talk. You have the floor.
Thank you very much, Eric, and hello to everyone. So it's a pleasure for us to be here today. Eszter and myself, we're going to present to you our Living and Working in Europe survey, and we're going to tell you how the COVID pandemic actually led to this new survey tool for Eurofound. Okay, so what we're going to talk about today is first we're going to tell you a little bit about our traditional surveys, and then we're going to explain how COVID-19 impacted on our surveys and tell you about the development of the Living and Working in Europe e-survey. That's my part. And then Eszter takes over to talk about the methodology. So let me start then by, well, actually first, you see this very nice picture. This is Eurofound's premises in the south of Dublin. We're a tripartite EU agency. Tripartite means that we have stakeholders from government, from trade unions, and from employer organizations. And our mission is to provide knowledge that assists in the development of better social, employment, and work-related policies. And what we do is we try to gather knowledge so that we can support the policymakers across Europe. And our surveys, we have a long tradition of fielding surveys, and really they form a substantial input for this knowledge. So they're the basis of a lot of the work that we do. And the three surveys that you see up on your screen are the surveys that we call our traditional surveys. All three of them are aimed at collecting high quality data. So we follow the 3MC CSDI cross-cultural guidelines. They're random probability surveys, and they cover all the EU member states and beyond with relatively large sample sizes. If we start with the European Working Conditions Survey, that's really our oldest survey. It started in 1991, and by now we have done 7 editions, or we have a 7th edition in the field currently. And you could say that the European Working Condition is regarded as the source of information about working conditions and quality of work and employment in Europe. As I said, the current survey is in the field. It's a face-to-face survey in 35 countries, but this time we're also testing in parallel an online push-to-web element. I'll say a little bit about that later on in the presentation. Our second survey is the EQLS. That's our general population survey, covers people aged 18 and over, and collects comparable data on quality of life, quality of public services, but also looks at quality of society across Europe. And we have a next survey coming up in 26. And then the third survey is also a pan-European survey, but it's slightly different. It's a survey of managers and employee representatives in establishments of at least 10 people. And it gives really an overview of workplace practices in these European establishments. We've done this survey 4 times, and 3 times were done using CATI, but the last time we did it, it was actually push to web. The next round for this survey is planned for 2028. Now, I already mentioned that our EQLS and EWCS are done face-to-face, but Eurofound has been in the process of future-proofing the surveys, like many other survey infrastructures. With face-to-face, we are facing increasing difficulties related to response rates, related to some countries having difficulties actually bringing together a field force. We also have a slightly different way of organizing the survey. So we always have a central organization hub, and then they take care of the face-to-face fieldwork in the member states. And for contracting purposes, that's not always easy. So we're starting to explore different data collection options as part of a long-term strategy. We're not there yet, but at the moment we, as I said, have an online test of the EWCS. So we're doing 500 online interviews, push to web. And what's interesting there is that we're really experimenting with different strategies. So we're looking at different recruitment strategies. So postal push to web, face-to-face push to web, and telephone push to web. And then we're looking at different questionnaire lengths, and we're looking at different incentive strategies. But anyways, today is not about the EWCS. I think it would be very interesting to do a separate webinar when we have the results. But when COVID came, like many other infrastructures, we were in the field with the EWCS in March 2020, and we had to stop face-to-face interviewing. And with the EWCS, we then switched to CATI. But Eurofound at that stage was really very much in need of immediate data. We wanted to understand what the implications of the lockdown would be for Europeans. And so we launched very quickly a new survey, and it was very much meant to be a one-off survey. It was online. We had never done online interviewing or surveys before. And most differently from what we had done in the past, it was non-orthodox in the sense that it was non-probabilistic. But as I said, we launched this first survey in April 2020, basically with us sitting at home, developing a questionnaire using mostly tried and tested questions from the EQLS. And we found a provider that's called SOSI, so a platform for the online interviewing. They are a pair of academics based at the University of Munich that were extremely helpful. And what we thought would be this really small survey, we would have been happy had we gotten 1,000 respondents. We ended up getting this immense response. Everybody was obviously sitting at home, interested in expressing their views. So at round one, we got nearly over 67,000 cases. And that got us excited. So very quickly, and also linked to how the pandemic developed. So in July 2020, it seemed at that time as if the pandemic was over. So we decided to field the second survey to get a better understanding of the outcome of the implications. But that really wasn't as much as a success. We'll come back to the reasons why we think that was the case. A year later, in March 21, but to cut a long story short, we have just completed round 7 of the survey. And over these 7 rounds, 250,000 cases have been collected. So really what went from a very quick survey became a long-standing tool that provided very timely information. For instance, we were able to show the impact of the pandemic on young people. So we all know by now that young people fared far worse than their older counterparts during the COVID pandemic. They were far more likely to be at risk of depression. They were more likely to feel socially excluded. And it turned out to be, let's say, correct information at that time, because all the other surveys then also started showing this information, but this was very early data and very timely as such. The other thing that the e-survey offered to us was that it allowed us to see where there was a data gap. So for instance, we asked about unmet health care needs on the 3rd round of the e-survey, and we were able to see that people with disabilities were more likely to suffer these unmet healthcare needs, acknowledging that some of these figures are high also for respondents without disabilities, but those with disabilities were even facing a harder time. So again, it provided very relevant information at a time where that was very much sought after. So as I said, it's now become very much a regular tool for Eurofound. At round 6, we rebranded it. So COVID was over, and we stopped calling it the Living and Working in COVID-19 survey. It's now called the Living and Working in Europe survey. And it has over time established itself as a regular tool for Eurofound, and we use it to study particular groups in the population, like the ones we already highlighted in the previous 2 slides. So young people or persons with disabilities, but possibly also platform workers. That's one of the topics we're exploring for our next round in 25. It's also proven to be a good instrument for us to test new questions. So we will be doing doing a lot of work in the green transition, and in 25 we will be including a lot of untested questions in the e-survey as well. And then to cover gaps where there's not sufficient data, and disability is one of these topics where there's often a call for more data. And in that sense, we're hoping to provide some information to the policymakers through this instrument. The other development was that the survey actually expanded to go beyond the European Union. In the 5th round, we collaborated together with our sister agency, the European Training Foundation, and this agency supports human development in a range of countries. So they have, as you can see on the slide, 29 partner countries, south and east of Europe, and reaching all the way into Central Asia. And so in the 5th round, we piloted it in 10 neighboring countries. Then in 23, they expanded that to cover 17 countries. And for now, the e-survey tool has also become a regular instrument for the ETF, especially considering that in many of these countries, there aren't the standard high quality surveys, random probability surveys. So this, again, it provides a method of collecting information in countries where it's less easy to do so. But the thing that I think we are most proud of is that our survey actually includes a panel component. So from the very beginning in round 1, we started to ask whether respondents could be recontacted, and we asked them to give us, if they wish to do so, their email address. And so far, over 60,000 respondents have left their email in one of the latest rounds. And in the latest round 7, we had nearly 18,000 panelists returning to the survey. And if you look at this little pyramid on your right, you will see that we have around 2,800 respondents that are really the diehards, let's say. They have participated in all 7 rounds. And if you add the any twos up until the all 7 together, it's about 35,000 people that have taken part in at least 2 rounds of the survey. And then there is a group of around 25,000 people that participated once, left their email, but then didn't take part in a second round afterwards. What we have also looked at is the rate at which respondents joined the panel in each round. And so what we saw is that, okay, at round 1, we had about just under half, around 30,000 that left their email address with us. In round 2, we had this dip, as we already explained, maybe too soon, or, well, Eszter will say a little bit more. But in any case, it was not a very successful round, neither when it came to new respondents, nor when it came to the email given. Then we had a slightly relatively good period. But in round 6, we had a dip again, and we are thinking that possibly the name change, so it became the Living and Working in Europe survey, was more general, not as appealing, possibly. We don't know quite what's behind it. There was no more COVID going on. Maybe there was survey fatigue also happening. But as Eszter will explain, we've also improved our methodology, and perhaps the success of round 7 is in part, can be explained in part due to the changes we've implemented. What we also wanted to show you is the achieved response rate that we got among the panel members. And so if you look at round 7, what you see there is 31%, and that reflects the, so we resend invitations to our panel members, but not all the email addresses are valid. So it's let's say our clean panel consisted at that time of around 57,000 respondents that were invited to take part, and then we got 18,000 responses. So that's to explain the 31%. What we wanted to highlight really is a couple of things. So in the beginning, in round 2, 3, and 4, the period between the next survey was shorter. So particularly in round 3 and 4, there was a 7-month gap, whereas since round 5, it's a yearly instrument, there's a 12-month gap. There have also obviously been some changes in the length of the questionnaire, which is something we're looking at. So round 5, as we showed earlier, was an extremely long survey. So potentially that could have also affected people. In any case, we are actually fairly satisfied to still be getting a third or 31% participation rate. What we've been developing over time is a system to send invitation and reminders. So we send out the invitation. That's the very first high bar. We get a lot of respondents coming right away. This is for round 7. And then after 6 days, we send a reminder. And so you see in this graph how the reminders bring up the response after 6 days, but each time it trails down a little bit. So each time the reminder becomes slightly less effective. And normally we would have stopped, but for some reason this time we decided, let's go for it one more time. And we got again 1,000 responses following that reminder. So that's something we need to look at as well. Work in progress. Now, a little bit of information about the distribution of the panel. So the age distribution, it's always been very much skewed towards older people, and that's in fact increasing. So the younger group, the 16 to 35-year-olds, but also the 35 to 49, they are less likely to participate over time. That's what we're seeing, and we're seeing an increase of the 65 plus group, which in itself, considering the methodology online, is interesting. But in terms of education, it remains very much a panel of highly educated respondents. That's very clear. And we haven't been able to influence that. What we have been seeing is an improvement in terms of the gender distribution. So whereas initially it was very much skewed towards women, it's improving. So it's still slightly more women than men. At the moment, it's 60-40, but when we began, it was 70-30. So we're seeing some improvements there. And again, Eszter, you will explain when we talk about the methodology, what could lie behind that. Now, last but not least, before I hand over to Eszter, the e-survey has become a widely used data source. The analyses that we did were some of the most downloaded publications from Eurofound during that period, but also the academic community has been using the data extensively. So far, over 200 articles have been published in peer-reviewed journals. We also published a few papers ourselves, and we get daily, almost daily requests still to get access to the data. The good news is that finally now the data will be archived at Essex, and we hope to be able to do that in the coming months. We're in contact with the data archive and we're starting that process. So hopefully it will be accessible to everyone. So on that note, I pass over to you.
Thank you very much. So I'm going to be talking a little bit more about methodology. And after you heard so many positive things about the survey, we are making sure that we know what this survey isn't. So this survey is not a representative survey, and we are always making sure that it's mentioned in all of our publications. And initially, as Daphne mentioned, that in the beginning, it was kind of a test survey, and we thought we would just recruit respondents via snowballing. So we sent it to our Eurofound's contacts and asked them to share it on various platforms. And adding social media advertising was just a bit of an experiment because we did this survey almost completely in-house. The only thing we did that was using the SOSI platform and to employ a contractor for social media advertising, originally on Facebook and LinkedIn. And so this is where we got the mass of the respondents. So we do say that we use the snowballing, but most of the respondents come from social media. And initially, you saw the kind of biased gender distribution and age distribution, and we tried to remedy this a little bit starting from round 3, where we pushed the recruitment kind of almost towards a quota. When we saw that there was not enough young men, for example, we changed the advertising. We asked the social media contractor to promote the survey more to those specific groups by country. So this has improved a little bit the gender distribution. Education was something that we were unable to control. So we didn't ever manage to push the survey more to people who have lower than tertiary education. But we did adjust these targets on a weekly basis and did various experiments with the survey. But still, we know that the population is biased and we don't really know the universe of the survey. And we are weighting the survey data. And what we are doing is weighting by gender, by age in 6 categories, self-defined employment status and education level. But we do know that we can only correct those biases that we know. So for example, we will never be able to correct for people who are not using social media, who are using ad blockers, or have digital skills that don't allow them to complete the survey. And in round 7, I will show you a little bit at the end more. We added some more experiments when we used different types of advertisements. And we saved this data where the respondent clicked on which advertisement they used to access the survey. And this is something that might help us to look at a bit more of the different types of biases. So when you compare the e-survey to a random probability sample, which is currently the ESS 2022, for which I had data for 16 countries, you can see that this is the age distribution, sorry that it doesn't show, so it's starting from 18 to the oldest age group. And you can see that all of our surveys have a peak at around age 60. So the survey is most popular between, let's say, 50 to 65, that age group. But then we have a large drop-off after age 75 or so toward the other end of the scale. Whereas the European Social Survey, this is the unweighted data, it's still a little bit more even distribution. When it comes to education, so when you compare to the ESS, that would have the highest peak at secondary level education. But our survey has a second peak for people with bachelor degrees. So basically, people who have a bachelor degree are the most common respondent in our survey. By the way, these charts are showing the complete survey, so not just the panel that Daphne showed before. Something else that is a little bit different is employment status. So in nearly all of the ways we are so the survey is more popular among those who are employed, especially in the first way. Whereas even though we are skewed towards older groups, we are under sampling retired people, or like it's less popular among retired people because the most popular age group is like 55 to 65 or so, 50 to 65 or so. Then, when we're using R for analyzing all of the survey, the analytic package for weighting, and it's just ranking at the moment, but we are experimenting a little bit with calibration methods for the future. And so, because it's like really not representative, we have a lot of extreme weights. We developed a script in which we are increasing the top weight gradually under convergence is achieved per country. So like we're weighting them by country, and then we're trimming these weights using the survey package for those who are familiar with R. Yes, so we are thinking about somehow correcting for some of unobserved bias. And as I mentioned before, many of it will never be corrected for. But we are thinking of new variables, for example, having voted in the previous elections, and disability and some of the other variables might be used in future weighting. And just to illustrate that, when you're asking, we don't have this question anymore, but I think up to round 5 or 6, we had the question about how often the respondent uses social media. We were using this to connect to vaccination, questions about COVID vaccination. And obviously, like almost everybody uses social media and pretty often, apart from those who have been shared the survey by people who do use social media. So we did a little comparison of what happens when we are weighting the survey. So this table compares unweighted survey results with weighted. And for the benchmark, we use the EU-Silk survey and also the ESS in this table. But yeah, we can compare those where we have the same type of variable. So unfortunately, many of the scales used in Silk and ESS are different enough that it's not sure that we are comparing like for like, but for demographics, we can compare it quite well. So as you can see, and as expected, after we are weighting the data, the demographic variables align quite well with the EU-Silk and the ESS. Another bias we kind of have is urbanization. So we are oversampling people in urban areas, but unfortunately the question we are asking in the survey, so we are unable to connect it to EU-Silk because they are using the Daguerre scale. In the past, Eurofound did some analysis of urbanization, and we are using in e-survey the question from the EQLS, which is kind of a self-defined urbanization status. And unfortunately, it doesn't correspond too well to the Daguerre from EU-Silk. So we don't really have the benchmark for that form. But just wanted to show you that even with the weighted results, we have 60% of people from an urban area. And also when we're weighting, it changes a little bit we are asking a question on kind of minority status and whether the person identifies as ethnic minority or part of the LGBTQI+ community. And this also changes with the weighting. I found it interesting. Oh yeah, and the reason why the age categories don't perfectly align with is because we are using different age categories than the ones showed here for weighting. Now, when you look at further than the demographic variables, selected a few that we have, for a few of them, we have some benchmarks, something that is health and disability, mental well-being, and also at risk of depression. This is also part of mental well-being calculated from the WHO5 index. So it does seem that the survey attracts people who have lower health and or have a disability a little bit more compared with Silk. And when we are weighting, it also increases the differences a little bit. So this is something that we are considering, that perhaps disability could be another variable used in the weighting in the future. Something else is mental well-being, which is we're measuring lower than other surveys, even though they are using different variables. But this is something we cannot wait for because we don't know whether it's a mode effect. People usually report lower mental well-being when there's no interviewer present. So this could also be related to it. Similar to subjective well-being and trust, we are measuring lower trust in the EU, trusting people, and lower life satisfaction than what was measured in the EU-Silk. It doesn't show here, but also lower than what was measured in the Eurobarometer. Then when it comes to financial situation, it's even different because in some cases, for example, the proportion of people who own their accommodation is decreased once we use the weighting, even though it was a little bit closer to EU-Silk originally. So similar to when it comes to arrears, whereas average weekly working hours is relatively correct. Something else I wanted to say that I forgot, sorry, when it comes to health and disability, we are theorizing currently that the reason why weighting increases the differences from the representative survey is that among young people, we might be attracting those young people who do have certain problems. And then, yes, I will show you the advertisements a little bit later and how it would be related to this. So now I'm going to talk about two of the experiments we have implemented to try to improve the survey, and also just to learn a little bit more about how surveys done on social media work. Last year, we ran the same questionnaire, or almost the same questionnaire, very slightly shorter one, on the public voice panel of Varian, and at the same time as the e-survey. We chose 6 countries, Czechia, France, Germany, Greece, Ireland, and Poland, with around a sample of 500 in each of them. And their panel is recruited through either face-to-face or random digit dialing. And currently we are working on a report where my colleague Gijs van Houten is working on a report analyzing the differences between our panel, our other respondents that are not part of the panel, and the public voice panel, and how they differ in various metrics. Currently, so far we found this, especially item non-response is higher among new recruits, but in the panel is more or less similar to the public voice panel so far. But yeah, this is ongoing work that's going to be reported later in the year. Then another experiment that we started this year. So yes, I mentioned already how we try to improve the targeting and how we think that many people are still outside the coverage. But something else that we thought is before, the images were developed by the social media company, but this time we decided to have a control over what advertisements people see and wanted to systematically collect this information. Because during the COVID-19 pandemic, we used things like masked people or hospital rooms. So it was very much a COVID-focused survey. And we think that the reason the survey responses dipped or dropped in round 6 was partly because it was no longer called a COVID-19 survey. We stopped showing people in masks and in hospitals. So it was just more of a general survey about living and working in Europe, and it was less popular. But we thought that taking control of the advertisements kind of will allow us to to see who are the people who are clicking on this survey. Yes, this I showed already, sorry. So what we did was we chose 4 topics that we thought are kind of topical in 2024. One of them was cost of living, then access to healthcare, social support, and mental health. And as a control, we also included an advertisement. We just showed like a general graphic of like someone filling in a survey. And for each of these topics, we chose a salient image, and the text was accompanying, was also more closely related to the survey, where we expected a strong response, and a non-salient, which was a little bit loosely connected to the topics. So the ones selected were, when it comes to cost of living, homelessness was one of the topics. Non-salient was a row of houses, which we thought was less connected, but then we found out it's pretty much connected as well. Then for access to healthcare, we looked at, we used an overcrowded waiting room versus a doctor just treating smiling patients. Then for social support, the image that I showed here was the hugging people, whereas the non-salient was just like a stock photo of 2 hands holding each other. Then for mental health, we used one when there was a person in distress on the floor. And then the non-salient, or rather the positive one, was an older couple on a trip and breathing in fresh air. And so the aim was twofold: first of all, to collect data on potential additional sources of bias, as I mentioned, but also we thought that even if one or more of these advertisements will be more popular than the others, we might be able to collect different types of people if we are using various versions. And then so the results, so okay, so we are currently just received this data set, so we just started looking at it. But what we do see is the cost of living was extremely popular among survey respondents. Both the salient and the non-salient slight difference between Facebook and LinkedIn advertisements on what was more popular. Then the second most popular topic was mental health, especially the salient one. So in this case, you can see the 4 images. The first one is the salient cost of living image. The second one is the housing, or non-salient, but it is actually salient. Then we have the mental health, the positive and the negative image shown here. And just before the end of the presentation, I wanted to show you a few just descriptive statistics on this and outcomes of the survey. So the first one is the housing insecurity. So this is, we were looking at the proportion of respondents that feel that they might lose their accommodation because they can no longer afford it. And this was much more common among those who clicked on cost of living, but also those who clicked on support and mental health, whereas it was low among those who clicked on neutral image or the non-salient happy mental health image. Another one that was interesting, that once you look at a different response, so feeling downhearted or depressed, so one of the negative effect variables, there you can see that this is very high. So the proportion of those who clicked on, so who said that they frequently felt downhearted, depressed in the previous 2 weeks, it was much higher among those who clicked on the salient mental health image, but also among those who clicked on the support image, which was more positive, but it was just, yeah. So this is something that is really interesting. Then if you look at, as you seem to maybe remember from the previous slide, healthcare was relatively less important among respondents, but it still had thousands of people clicking on it, just lower in proportion. Once you look at the proportion of respondents who perceive their health as bad, these are more common among those who clicked on the healthcare, both the salient, non-salient, and also among the mental health image people. So this is something, this is just descriptive, but something that we want to look at in much more detail, and maybe we can experiment a little bit with how to use it for correcting the data. So, oops, yes. Finally, yes, so this is just the conclusion of our presentation. So just to reiterate what Daphne said, that this survey will never replace our traditional random probability surveys. We are continuing, even though we are experimenting with how we are running those, but we are definitely continuing our random probability surveys in the future. And these, those are the ones who are providing us with comparable data needed to monitor trends and living and working conditions. And this survey we are using to test some new ground, testing some questions. For example, for the upcoming EQRS, we have already tested a few, and in the following years we will as well. Or to focus on some specific subgroups, especially those who are likely to be online, such as platform workers, and to fill data gaps just like we did during the pandemic. And yeah, so that the data is available. It will be, all of it will be available, including the panel data, which hasn't been so far published, on the UK Data Archive later this year. And in the meantime, we have been giving it out like on an individual basis. And this is it. Thank you so much. If you have any questions, we are both very happy to answer them.
Thank you very much for that. That was extremely interesting. Lots and lots of work's gone into to struggling through that period of COVID. You can still keep putting your questions in the Q&A function, which is at the bottom of your Zoom screen. I'm going to start with a point of clarification of my own. So you show us quite a lot of charts about the demographic breakdown. Maybe it was a slide I missed, but I was curious about the country by country spread of how effective you were in reaching people. I didn't see any sort of cross-national comparisons. So just as a point of clarification, really, would you say this was something that was sort of equally successful across all your normal target countries? Or did you actually find that there were large national differences in the number of people you were able to reach using this method?
Yeah, so thank you for that. And I definitely should have put in at least one chart by country, but maybe it's still interesting if I just talk about it a little bit. So this was actually the main purpose of the retargeting, apart from age, gender, and what we try to do with education. That just the survey was naturally more popular in some countries than others. In the beginning, especially, it was popular in Eastern European countries. And we tried to push it a little bit more. So we were able to redirect the budget towards the the countries where it was struggling more. One country, if it's interesting specifically for you, we have always struggled, was Austria. That's consistently in every wave and in every social media platform. We try to add additional money on LinkedIn for Austria, but no, much fewer people were interested in the survey. We still have at least 500 people in each wave in Austria, but just much fewer than in other countries. Then when we were last year, we pushed a little bit the topic of youth. We had a set of questions directed at young people and their future. So the advertisements were also focusing on this topic. And that was the year when somehow it became very popular in Germany. So from last year's database, we had a lot of young people in Germany. They are a little bit dominating the youth sample. So of course, waiting does take care of that. But yeah, so every year we have separate advertisements. I mean, this year the same advertisements, but a separate social media strategy for each of the countries, and we are redirecting it on a weekly basis. In that way.
Thank you. Yeah, I was struck. Obviously, I did have a lot of undergraduates doing dissertations, basically using social media as a platform for, distributing their little surveys. And I was particularly interested by what I thought was quite ingenious, this idea of sort of taking into account what you saw as the potential different demographic take-up, popularity amongst particular platforms. So there is, as you say, this thing about Instagram being a young person's thing. And there is a joke, isn't there, amongst, certainly my daughter says that, Facebook's the thing that used to be great before your parents got on it. So I think that's quite sort of interesting, sort of technical wrinkle in terms of trying to sort of target these sub universes that you're trying to take. So that's very interesting. There's a question about the use of this work. Marshall asks, how will you present the kind of work that Eurofound has done and is still doing to improve the survey? In terms of sort of trying to improve quality of life amongst European populations. So it's a question about dissemination and use, really, I think.
Yeah, that's a good question. We're going to be writing some working papers on the outcomes of all this work. So work in progress, those will be published on our website. But this is also the kind of information that we would be presenting at conferences like Ezra. So we're hoping to do that again. Gijs already gave a presentation with very early sort of results from the non-prob test. But once the working paper is published, we hope to be doing some more presenting in terms of dissemination. And then also all the work that Eszter is doing with social media. I think very much possibilities for presentations, and also as part of, let's say, our overall work, future-proofing the surveys, we'll be writing several working papers as well.
Yeah, and maybe if I can add, when it comes to the content, we have been using this data regularly. So we do say that we are not using it for point estimates. We're only comparing within the survey different groups. or over time when it comes to the panel, but we are not, so we are making sure to say that, okay, so this is not representative, but it's showing this, and we are usually using it alongside representative data in our reports.
Thank you. So you make the point about the sort of relationship between what you've been doing with this panel and sort of more traditional probability work. And that sort of links into sort of a pair of questions from John Dine. Basically says, so in terms of the relationship between this and EWCS and EQLS, well, firstly, what are the implications from what you've learnt about what you've been doing here for what you plan to do with your future proofing of those surveys? And then coming back the other way, are there any opportunities to use the next iterations of EWCS and EQLS to reboot the panel, if you like, to start all this up again, but on a probability basis this time? So either order, or whatever you like.
That very good, nice question. The latter is precisely what we're aiming to do. So we would very much hope to be using the EQLS as a way to improve the quality, or to make it a mixed, let's say, prob, non-prob. We have to look at it, right? We don't know exactly how yet, but we will certainly invite the respondents to the EQLS to take part in this panel. The composition of which then depends a little bit, but I think this is something where we would also be very interested in exchanging with other methodologists and getting a little bit of their input. Then in terms of the impact of the e-survey on our standard surveys or on our future proofing, no, we think we sort of see them as separate. So they're really, as we said in the presentation, they were very useful during the pandemic because they provided information when there was no information available. Now we will use them on a yearly basis to test new grounds for topics that aren't yet well researched, or where the questions are new. So it's a good way of testing new questions, but it's not going to influence the path of future proofing our standard traditional surveys. I mean, the only thing you could say is that we learn a little bit about online, about the length of the questionnaire, that kind of stuff. It's very useful. But, you know, the EWCS test, that's our real testing ground. That's where we're really going to draw lessons for the future proofing. So the current EWCS test will provide that kind of knowledge rather than the e-survey.
Thanks. Yeah, one of the things that I found very intriguing about this work is particularly in terms of sort of targeting the relevant populations for policy problems and initiatives. So, you know, obviously, you know, if you're going through social media, and also the stuff about the sort of using salient adverts, sort of adverts that were indicated that the content, I mean, on the one hand, clearly not representative of a general population, but of course, policymakers are very often interested not in nationally representative populations, but in pre-targeted or pre-identified subgroups where, you know, where there are people they want to reach, or they're people where they want to make interventions. And so it's quite interesting, you know, representativity aside, it's quite an interesting and useful tool in terms of the way you went about sort of COVID. Because if you're interested in the way that people were experiencing COVID or reacting to it, then clearly, you know, you want to reach a particular types of subgroup. So all kinds of interesting lessons, I think. And there's another question. Yeah, so this is specifically about the methodological difference between what you did and EU Silk. So there's that, and then also if there is a panel and you introduce new questions with every wave, the use of the panel is still limited, presume in terms of the size, presumably. Do you have any plans here?
Yeah, so in terms of the EU-CIRC, so first of all, it has a much bigger sample size. It's collected differently a little bit in each of the countries, but it's kind of harmonized afterwards, as far as I know, within Eurostat, or like Eurostat is setting a specific way for the countries to send the data in a specific format. But it's a much bigger, systematic and representative survey in each of the countries. And this is completely different. And this is why I used EU-CIRC as a comparison, as something that I would see as like a completely representative survey. And in some countries, as far as I know, it's even compulsory to fill it in, or so it's very different. But when it comes to the panel, we do have a core set of questions in the e-survey that has stayed the same. And these are the ones we are focusing on. And actually, most of the questionnaire, I would say, stay the same, except that I actually quite tested questions from previously from the EQRS. It's just that we added a few questions in each wave. I mean, the biggest use of the survey was that it basically gives you instant data on what you're interested in. So when it was about how COVID has impacted you, have you lost your job, that was in the first wave, or are you furloughed? Then in the third wave, we were asking, okay, the vaccines came out. We asked about, are you planning to vaccinate? Have you vaccinated? The proportion of people who vaccinated was remarkably similar to what came out from official statistics later. That was interesting. By country, even as far as I remember. And then, so we added these little interesting questions that were now, we even added some questions at the very end of the survey about the war in Ukraine when it broke out. And views on the government when it comes to that, and so this we do add these questions in addition at the end, but we have a core set of questions that are the same across the waves. Yeah.
Thank you. Well, we seem to be at the end of my list of questions in the function. So I think as we're pushing 1 o'clock, we'll draw proceedings to a close. So thank you once again to Daphne and Eszter for a very interesting presentation. That's a wrap now on this series of seminars. We're taking a break over the summer, but the series will be returning with more great stuff in the autumn. So thank you all for attending. Have a great day, and from everyone here in London, it's good afternoon.